Today is Tuesday, November 2nd. This is the Public Health and Safety Committee. We have a quorum with Evans, Johnston, Porterfield, Pulley, Roberts, and Swope. We're going to go ahead and get started with resolutions that are on our agenda today. And taking a look, I listened to budget yesterday, so is there any objection to all the resolutions that we have, to go ahead and put them on a consent calendar?
So moved.
All right.
Seconded.
Very good. All right, I'll get started. Resolution RS 2021-1199, Allens, Evans, and Welsh approves an application for a coronavirus emergency supplemental funding CESF grant from the Tennessee Department of Finance and Administration to the Davidson County Juvenile Court to mitigate the spread of respiratory droplets and or reduce transmission of COVID-19 by utilizing masks and plexiglass barriers in courtrooms. RS 2021-1205 by Johnston, Gamble, Sepulveda, Allen, and Evans appropriates $996,500 in American Recovery Plan Act funds from Fund Number 30216 to the Office of Emergency Management to be used for COVID-19 related response vehicles and technology. RS 2021-1213, Allen, Evans, Hauser, and Welsh approves an application for a coronavirus emergency supplemental funding CESF grant from the Tennessee Department of Finance and Administration to the Metro Nashville Fire Department to increase capability and capacity for providing more efficient and effective transportation and supply services for Nashville's and Davidson County's homeless population. RS 2021-1214 by Allen and Evans approves an application for a Homeland Security grant from the State Tennessee Emergency Management Agency to the Metro Government Office of Emergency Management. RS 2021-1215 approves an application for a coronavirus emergency supplemental funding CESF grant from the Tennessee Department of Finance and Administration to the Metro Government Office of Emergency Management to provide logistical and practical means for increasing capacity and more effective delivery of services while addressing the specific needs of the homeless population and their environment. Do I have a motion?
So moved.
All right, it has been moved and properly seconded. All those in favor?
Aye.
Yep.
Any opposed? All right. All right. So now we will move to bills on second reading. We have BL 2021-841 by Rosenberg, Mendez, Suarez, Sepulveda, O'Connell, Benedict, Welsh, Parker, Roberts, and Porterfield amends the Metro Code of Laws to pertaining to the use of license plate scanner LPR technology in the public rights of way. Do I have a motion?
So moved.
Second.
All right, return to the sponsor for discussion.
Thank you, Madam Chair. So I'd like to draw folks' attention to the substitute in the packet for future reference, but I don't think it's ready to move forward to an unamendable state. I'd like to defer 2 meetings, please.
Okay, the motion has been to defer for 2 meetings. Do we have a second? All right, all those in favor?
Yep.
Aye. Any opposed? Thank you very much. Next one is BL 2021-961 from Johnston, Pulley, Nash, Rutherford, Stiles, Gamble, Hancock, Howell, Hauser, Cash, Ruffle, Young, Toombs, Hagers, and Withers. Amends the Metro Code of Laws pertaining to the use of license plate scanner LPR technology in the public rights of way. Do I have a motion?
So moved.
Seconded.
All right, thank you. Open the floor for discussion with Councilwoman Johnston.
Thank you. I appreciate that. I'm going to move it says a proposed substitute. It's actually an amendment. That was staff error, and I will let Council Lady Gamble speak to her amendment, which I find friendly and support.
All right, Councilwoman Gamble.
Thank you, Chair. Yes, this amendment restricts the use of the LPR cameras in Section 1 and G1, where we're adding felony offenses as the offenses that would be eligible for use of the cameras, as well as criminal offenses restricted to violent crime, gun crime, homicides, assault. It specifically names what type of criminal offenses. So initially it was more broad with criminal offenses. This amendment is a result of communications from ACLU, COB, and what we've heard from the community about concerns with using the LPR technology in that broad way. So restricting it to felony offenses and criminal offenses involving violent crimes, as well as continuing with the other stolen vehicles, Amber Alerts, and those things. Also, it adds that instead of the council members, 2 council members being on the audit committee, a committee of individuals that are able to audit the logs of the LPR use by law enforcement, it would be restricted to the district attorney, the public defender, and a member of the community oversight board. So it's taking the council representatives out of that. And then lastly, adding to the reporting period, reporting information rather, during the pilot of this program, because this program is being introduced as a 6-month pilot. During that period, the council receives reports of the use and adding in any misreads that may have happened during the pilot period of use. So including that as well in the reporting period. And as I said, these are results of concerns that we've heard from the community through the many community conversations and town halls that we've had, as well as from the COB and ACLU.
Thank you for that explanation. Is there any discussion? All right, all those in favor?
Yep.
Any opposed? I know Councilwoman Benedict has an amendment, but she is not here.
She's withdrawn it.
She's withdrawn it, yeah.
All right. So I'll turn it back. Need discussion, I guess, now that we pass that on the legislation. Okay, Councilman Rosenberg.
Thank you. I move to defer 2 meetings to mirror what Transportation Committee did.
Second.
All right, we've got that properly moved and seconded. All those in favor? Any opposed?
No.
No.
I'm a no.
So 4 no's. All right. I'm sorry I didn't open the floor for discussion. Is it too late to roll back and open the floor for discussion? It is too late?
Yeah.
Okay,
I think
sorry
most of
about
us just
I
have
know,
this
yeah,
discussion next
exactly.
door, so.
So
Hi.
what is it, 4 to 4?
We have,
But I would say, if you wanna raise hands instead of doing a roll call vote, you could do that too.
yeah, okay. We can do it again. All those in favor of the or deferring for 2 meetings? And all those opposed? Okay. All right, thank you.
Excuse me, Chair, I was in committee. Could I speak to my amendment that I'm withdrawing, just
I
very
mean,
quickly?
is that allowed? We've already deferred the bill, so.
You blew right past that.
I would, thank you, Chair, just very quickly, this is an amendment that I introduced to both LPR bills that are in front of the body tonight. And in a nutshell, it was not written correctly in that it is absolutely not intended to take away from the opportunity for public funds, whether it's federal or state funds, to be provided for donations, but rather it is specifically to exclude private funds from making these donations, so as to make sure that the public's that the public is not being monitored by private entities, or that private entities have an interest in this equipment. So I am withdrawing the amendment, but I just wanted to make sure that context was out there in both committees. Thank you, Chair.
Okay, thank you for offering that information. So that concludes our agenda. I do have a couple things. First of all, you may have seen the media advisory from the mayor's office. Thursday, there's a Partners in Care update for the first quarter results at the Hermitage Police Precinct, if you're interested in that. It is at 9 a.m. at the precinct. And then I also wanted to see if Tom Sharp and Director Swan had any updates. So Tom, did you have anything you wanted to share on behalf of the
Yes,
health
ma'am,
department?
if you don't, you've got a second. So the numbers have been trending very good, very well. The 7-day moving average is down to 13.4, which is low as it's been since, probably late July, looks like, and it's been going down steadily. The positive tests are lower. The 7-day average is lower than the 14-day average, which is a good sign. It means it's still trending downwards. On the vaccine front, we have, let's see, 62.7 are 1 or more, 58.1 fully vaccinated, As you know, we anticipate the approval for 5 to 12-year-olds, 5 to 11, will be forthcoming, and we hope to start offering that next week.
Okay, and I'm glad you brought that up, because one question that I wanted to ask you all is, from a distribution standpoint for vaccinations, are you partnering with MNPS to offer some
We're in regular
opportunities?
discussions with them, so unlike when the vaccines first got here, winter before last, or whatever the heck it was, basically we were the only ones that had it, so we had a lot of that kind of arranging to do. This one will be available widely commercially. We're hoping the pediatricians will take it. The Walgreenses and the CVSs will have it. The other places that have had the vaccines all along, it'll be available to them. So the pressure on us to get to places broadly is not as great. We're planning to have away teams, strike teams go to schools, but not during school hours. They'll just be at the school so that parents can either during drop-off or pickup can bring the child in if they wish. We won't be able to get to all of them. We don't have the wherewithal to do that. We'll try to target the ones where we think it might be most needed for those areas of town. And probably start at the, I forgot now. I don't know if they were talking about high schools or not. That'll be largely up to MNPS, is where the traffic flow and the other logistics work for that facility. The high schoolers have been eligible. Most of them have been eligible for a while now, so we're not sure how much, if the juice is worth the squeeze really to go to the high schools unless they're co-located or fairly close by to either a middle or an elementary school. And then, of course, we'll keep the testing and vaccination center open on Charlotte and on Murfreesboro Road. And then the strike teams will be going out just like they have since for over a year now to, birthday parties and anytime people stop at once, and we'll try to go give them a shot if they want.
Okay, thank you. Does anybody have any questions for Tom?
Thank you for that update. I did have two questions. You talked about it being readily available to CVS and Walgreens and places like that. Is this available at no cost for individuals that don't have insurance?
It is for us. If
For
they
us, but for those private entities?
Some of them may charge an administration fee. I'll tell you the truth, I'm not sure.
Okay, so, and I bring that up to say, but we do have individuals that don't have insurance, so I think that it's important that, even though it's readily available commercially, we don't want cost to ever be a factor.
No, and none of ours cost anything to anybody. So they, either strike teams, wherever they go, whether at the schools or some other place, the assessment centers, it's free.
Yes, I understand, thank you. The point that I'm trying to make is that it would be great if we continue to provide it for those students. I know you say you won't be able to do every school, but if we find a way to make it available for families to be able to get it, because not every family has insurance. So if a family of 4 children can't afford to take their children to CVS and pay for shots, we want to make sure that, if their school doesn't provide it, we have to find a way to provide it. And I know that a barrier that we saw with the testing, which y'all have done a wonderful job, but that testing is during business hours. So people that are at work can't come in the evenings or the afternoon unless y'all have a pop-up site. So I'm just encouraging you all to, find a way in the afternoons or on the weekends so that families are able to get the vaccine at no cost.
Yeah, I want to mention that. That's a good point, but then give props to health department and especially our partners with Harry, man. Just such an incredible job that they've been doing from the beginning of this process. The strike teams that he's referring to on the weekends, Harry actually has what we call a mobile unit, just like the health department. And we've all have talked about even joining together so that we can identify certain areas that maybe when we have this situation happens, which is a point that you've made, that we would be able to provide that. So again, I know this is from the mayor's office, and I can freely say this. I've been on this team since the beginning of it. We want to make sure that everybody that wants that vaccine can get it, and we'll work any way we can. Speaking of the assessment centers, I want to bring the attention to everyone that we're going to fall back on time this weekend. So the hours that we have been doing was from 7 to 1. So we'll be moving Monday from 8 o'clock to 2 p.m. At both sites. But again, we'll make sure that on the weekends and other times, whatever we need to do to work together with the schools or certain communities that provide this free access.
Thank you.
Councilman Rosenberg.
I'm sorry, just following up on that.
I can wait till after you.
Oh, okay.
So it's gonna be getting lighter earlier in the morning, so why are the hours being moved?
Well, it has a
later?
lot to do with, when we come up with these times, it wasn't that we just pulled them out. It's just dealing with, number one, safety for the staff there, because by the time they all have to get their hour before to set up, and it takes an hour afterwards to actually break down. So when the time changes, is also due to the weather too. When you talk about in the summertime, it's extremely hot. You know that when you're out on the asphalt, if it's 90 degrees, you can add 15 degrees easily to that. And in the winter, it's the same way. So these times that we've selected is based off of the time that they get there in the morning, so there's some type of light, so when they set up, it's safe, and then in the afternoon when they break down, because we're getting assistance from our National Guard, and a lot of people come from other areas. So this is just the best time that we found that makes it more sense, and it works better for the staff, safety purposes, and also we've not had any issues with, I mean, I'm sure you may have where, as she was saying earlier, about people not having the time frame to come to these assessment centers, but that's why we have these strike teams on the weekends. And I will be quite frankly and honest with everyone, people are not utilizing it either. I mean, we announce where they're going to be, we try to make sure we put a big push, but we just don't get the traffic that we would like to. So understand, we'll do what we need to do. We won't mess with the assessment time hours because, again, it's also about longevity. Meharry's been doing this now, I forgot the week that we're in, but from the beginning. So we're trying to make this work in a system that will keep them safe. It'll keep them able to do it in a time frame that it's not going to be a big restraint on them, because they all have families and issues like everyone else. But also the weekends are available, and we have a lot of room for that.
Yeah, well, thank you for that. I guess if it's getting light at 6:30 now, starting on Monday, it's gonna be getting light at 5:30 in the morning. And I know a lot of people take advantage of testing before school.
You lose the afternoon time frame is what you're asking. So it, you know.
I'm concerned about losing the 7 o'clock to 8 o'clock hour when people can go before school and work, and it shifting to only during business hours.
Right. Well, that's just, that's the time that we've had, and we moved that only because, again, it's just daylight saving time, and that's how we adjust those hours.
But it's gonna be light earlier in the morning, so it'll be, if they got there an hour earlier in the morning, they would have the same light they have now. Is that right? Is that wrong?
Well, but you're not counting your off time in the afternoons because it's going to get darker earlier. So now, again, it takes an hour for them to break down. So it's always based off of their safety. If you find a time frame, and again, I understand your concern, but we're looking at this in a system, in a way that we can protect Meharry's staff and make sure that their setups, it takes an hour before and an hour afterwards. So their cutoff time, it gets darker earlier. So in the afternoon, if they shut down at 2 o'clock, they're not going to get out of there at 3, sometimes 3:15, 3:30.
Right.
So that's why we adjust our time frames. And according to the weather as well. And you guys know inclement weather, it can be versatile. You just have to stay tuned, and we try to put that out as quick as we can.
Thank you.
Thank you. How about any other? No?
Two.
Yeah, can I go back to, all right.
To just change the subject for a minute, I know we were talking last meeting about potentially having some kind of update on the emissions control
Yeah.
issues. We haven't had a chance to do that yet.
Yeah,
Still-
so.
Still on the agenda?
So I think it's something will probably be forthcoming. I don't know that if it's gonna track with anybody filing something or not, so that's kind
So
of
how
where we
much
are.
do
But
you
you're
want to know
welcome.
about emissions control?
You're welcome,
Well,
if you'd like
It takes
to,
a while
if you wanna explain, I guess, the position maybe that the health department has, but before we do that, can I go back to Councilwoman, cause I'm sure that you probably have a question related to the testing, right?
My question was just, is there any data on what percentage of Nashvilleians have gotten the booster shot?
Probably, I'll have to find it. I
Okay.
suspect we know.
Okay.
But I don't know that I saw it in there right off the top of the
Okay.
cutoff, but I'll find out.
Okay, thank you.
Yeah, they keep up with that.
Thank you.
There's at least one of us.
Any other questions before we transition to emissions?
I think there's
Okay.
a bill before.
Do you want to give your perspective, or the health department perspective about
To
emissions
answer your
testing?
question, I mean, I think somebody said the contract is up in June
That's correct.
currently.
There's two.
And so, I guess, you know, when this started, obviously, cars had carburetors, they didn't have emissions control like they have today. I'm just curious, what percentage of cars fail at the moment? And are we really at a point where maybe the squeeze isn't worth the juice anymore? I throw that out there.
It's a fair question. So, they model with the value of the vehicle emissions testing, and over time, it gets less effective, but it still remains the single largest source of NOx, nitrous oxide control that we have. And there's nothing else we could get that would make up for that much NOx. And that's the thing that worries us most, because that's what goes up there and creates ozone, which is the standard we're closest to violate.
So, but how many cars are found to be failing in?
Roughly 10% fail in any given year.
Is it because of an
Yeah.
actual emissions issue, or could it be like a fuse? Because I've had,
Let me, thank you for asking that.
Yes.
Hang on a second. There's a lot of people that think that check engine light, or the maintenance or check engine light means there's a bulb out or something. That's not true. Those things are calibrated to reflect a failure of some portion of the emission system.
However, if I may add, usually it's a failed oxygen sensor. And on most modern day cars, there's anywhere between 4 and 6 oxygen sensors. And if any one of them gets clogged at all, it just triggers your engine light. Now, does it change the emissions coming out your tailpipe? No.
I would beg to differ.
I've failed because a fuse was out, had nothing, check engine light wasn't on, there was no, I don't even know what it was affecting, to be honest. And even the guy at the thing said, this has nothing to do with your emissions, but you're gonna continue to fail until you get the fuse. It was like a 25-cent fuse, popped it in there, it was fine, had nothing to do with it.
Next time that happens, come to Lentz and we'll run it through the referee lane and see what that is.
Well, I mean, we've sold the car by now. But anyway,
future owner.
yeah.
So
But-
it's, and this will be a larger conversation
Yeah.
that we're all gonna need to have. We recognize that it annoys the heck out of a lot of people, especially right now, when they're having a real hard struggle keeping the
Staff.
station staffed.
Remember that sole remaining county in the middle of a
And, you know, they're not alone in that. If you guys know, I'm sure there's a lot of folks that are having trouble keeping staff. I went to the bank the other day and they had somebody out on the sidewalk, but they didn't have anybody in the bank.
The contract doesn't necessarily end in June either, it's a 30-day out. So
That's correct.
you could end it with a 30-day notice written and you're done.
That's correct.
About how much do we make annually on that?
We test about 600,000 cars a year, and it's $350 to Metro per test, so it's a little over $2 million.
And where does that go?
Some of it goes to the clerk's office, some of it goes to that maintains the program. I'm getting paid to talk about it right now.
All right. How about, and so I know this is gonna be a further conversation that we'll be having.
Right, so one thing to keep in mind, though, is that because of all that has happened at the state level and the federal level, if the decision that collectively is made to keep the program, it's no longer has to fall under the EPA protocols. We can make it a whole lot more user-friendly. That's one of the reasons I try to keep this vehicle emissions license plate sensor thing in all these license plate bills. If we can ever get that up and running, I think people don't like it a lot.
All right. Yes, sir. Councilman Nash.
Could you get kind of the same effect if you only required it once every 3 years?
That's the kind of thing we're talking about, doing it every other year, maybe exempting the first 3 years, there's a lot, we have a lot more leeway to design the program to make it friendlier. If we could get the remote sensing running, we could cut the number of people who have to go to the garages down considerably with that, we think. So, we're happy to have this conversation, but there's a lot of moving parts, as it were.
And can we get out of the EPA thing right now?
We're out of it.
Oh, okay.
Yeah.
Councilwoman Porterfield.
What's stopping the remote sensing from being a
Until the EPA's action, it was against the law.
But now it's not.
Now it's not.
So we could technically get rid of what we have now and do the remote sensing.
Theoretically.
What's that fiscal note? What's that fiscal note to go to the remote cameras that would handle what, the LPRs using it.
So it's, I mean, it still costs $9 to the recipient of the test.
No, I mean for us to purchase the technology itself.
I think they actually pay a little bit more to Metro than the garages do.
So it would just be another contract with another company, so we wouldn't be
currently have that
purchasing anything?
contract. Yeah, we
Okay.
put it in place in 17, knowing that it wasn't illegal at the time, but we knew something like this was coming.
Okay.
And so we wanted to have it available to us. We'd hoped we could have it up and running for at least a year and a half before the contract's ended, so people could see how it worked, we hope. But unfortunately, it took the EPA so long, we didn't get there, so. And I don't know that they'll want to start between now and June, because I don't think they can recoup their startup costs in that period of time, so.
We only drive hybrids. Do hybrids actually put emissions into?
It's got a internal combustion
Yes,
engine.
it does.
Yeah, I didn't know.
Unless you're
I
fully
drive one
electric.
too.
It's not.
Yep.
I have to go get mine tested.
Councilwoman Porterfield, did you have another question?
Yes, one more question. With the remote sensing, would everyone have to pay to be tested, or would you only have to pay if your car failed? If it rolled by a
It's against
sensor
the
and
law
it
for
failed?
us to dirty sense an automobile, to dirty screen a car.
Yeah.
Do what she
Everybody
says.
would still have to pay.
We
the-
can't,
the
we can't
$9.
pick out the dirty ones and say, you've got to get it fixed and ignore everybody else. You test everybody or.
Yes, I understand you test everyone. I'm asking, does everyone pay to be tested, or is it just,
So if you drive by under the sensor twice within a fixed amount of time before your registration is due, you'll receive notification in the mail that your car has passed. You go get your passing emissions test and we make you know.
okay.
But you still have to pay the $9 to get that emissions pass.
Correct. And if we went to every other year, you'd probably pay $18 every other year, if we did that. There is another option that's available, in the state law that did away with it in the other counties, is you can if you do away with vehicle emissions under certain section of that law, which we think we could probably do, then you can add $4 to the cost of a registration with $1 to the county clerk's office and up to $3 for, we would hope, for for air control purposes. That is another option.
All right, we're coming to the conclusion of our time. You've got one last question?
And air control purposes, what does that look like?
Well, so we control a lot of stationary source.
It's going.
So for instance, there may be some very large pumps that say, I don't know, the water station.
Gotcha, all right.
That could be upgraded for.
Thank you. Thank you so
All
much.
right, thank you for your time. This meeting's adjourned.
Thank you. Thank you.
Thank you.